Health communication is a very broad area of research and practice. It involves applying all the tools of communication, both the communication arts and the communication sciences, to solving important practical problems in healthcare.
Biomedical informatics makes sense of the tsunami of data coming towards us. Harnessing information to make new genetic discoveries, support personalized medical decisions, and improve population health.
Biopsychosocial model is a broad view that attributes disease outcome to the intricate, variable interaction of biological factors, genetic, biochemical, etc., psychological factors, mood, personality, behavior, etc., and social factors, cultural, familial, socioeconomic, medical, etc.
Joe is a healthcare executive with questions about ACOs, like why do ACOs matter? In theory, ACOs have the power to increase profitability for top-performing providers, while simultaneously achieving better health outcomes. Their growth has been remarkable, and ignoring ACOs means ignoring a key influential customer class. And just what are ACOs? Having its origins in the Affordable Care Act, ACOs are groups of healthcare providers that collaborate to ensure the highest quality treatment for a population segment.
MD is a pediatrician specializing in adolescent medicine and a clinical assistant professor in the Division of Adolescent Health and Medicine, Department of Pediatrics at BC Children's Hospital and the University of British Columbia Faculty of Medicine in Vancouver. Dr. Vo earned his medical degree from the University of Pennsylvania. He then completed his residency in pediatrics and fellowship in adolescent medicine at the University of California, San Francisco. In partnership with Dr. Jake Locke, Dr. Vo co-developed MARS-A, which stands for Mindful Awareness and Resilience Skills for Adolescents, an 8-week mindfulness training program for adolescents with depressive symptoms with or without other co-occurring chronic illness or chronic pain. Dr. Vo is the author of The Mindful Teen, Powerful Skills to Help You Handle Stress One Moment at a Time. His medical practice, teaching, and research emphasize promoting resilience in young people to help them thrive in the face of stress and adversity. Dr. Vo has been practicing mindfulness regularly since 1999.
From forgotten tools and an operation on the wrong side,
they messed up and did this side and then did this side,
to tests that cause bald spots.
Hair loss. I had a perfect ring around my head.
And metal deadly close to a magnet. We're counting down my list of 25 shocking medical mistakes.
One of the key elements of success is teamwork. Now, teamwork works like a clock. For a clock to work at all, you need all the parts functioning properly within a collaborative setting. In healthcare, many professionals work interdependently to achieve a common goal: patient treatment.
Apple products are the best, and they're very user-friendly. When you hear your friends make that statement, do you ever question it? Even though you disagree, you keep your mouth shut because you don't want to be an outcast. That's conformity. When conformity within a group leads to dangerous results, it's called groupthink.
So in healthcare, bias comes in various forms. And I would say there's 3 primary ways that we could actually track bias. One, of course, is in interpersonal interactions, let's say between a patient and a provider. So the unconscious ways that we may have associate certain groups, certain gender identity, people with certain gender identities, people from certain racial or ethnic backgrounds, manifests in The diagnoses.
An example of intersectionality, policy, and public health. Louisiana has consistently exhibited a number of public health problems throughout the years. Some current issues include high HIV infections among youth ages 15 to 24, high STI infection rates among youth ages 15 to 24, high rates of unattended pregnancy among teens ages 15 to 19, and inconsistencies in youth access to sexual health resources like sex ed and other healthcare services. Youth ages 15 to 24 accounted for 1/4 of all HIV infections in the United States. Baton Rouge and New Orleans ranked second and third respectively for the highest HIV rates in the country.
Health literacy is about making informed decisions and taking actions to promote and protect health.
Hello, what's your name?
My name is Deepika.
Hi, Deepika. Yes, please.
Doctor, I am suffering from fever, and since last night, I'm actually having those shivering and a real bad headache.
You're suffering from fever since last night. So any medicine you took, to cure that? Not really. Okay, so Deepika, I'll just take your temperature and then I'll prescribe you something.
In a diverse society and as human beings, we tend to create stereotypes and sometimes even discriminate